Why don't we put some needles in my ear?
Perfect. Okay. Now, and I'm sterilizing my hands.
Right.
And now we're going to sterilize your ear.
And Mohammed will come to the mountain.
Oh, definitely.
Okay.
That's much appreciated. And I'm using a little baggie here to just dispose of the
right.
of the waste. And here come the needles.
Okay.
So the needles are individually wrapped, like I said. And we can all see the ear. So take a big breath for me, Charlie. And out. So here we go. The needle is in.
Okay.
And I'll just put 3.
All right.
Okay. Take a big breath for me. And out. Perfect. And I'll put one more just to show a different area of the ear. Big breath in and out. So here we go. Charlie has 3 needles in.
Okay.
Any sensation?
Well, I can feel some tingling.
Tingling, right.
Right.
That's one of the common sensations of acupuncture.
Right.
You know, I always ask, do you feel anything, any sensation?
Right.
Usually it's a pleasant sensation of like pulling or tingling. You may feel like the area that got needled is really heavy.
Mm-hmm.
If it's the legs or the arm, you know, people feel as if during progressive relaxation, they just are totally relaxed and their limbs are heavy, right?
Okay.
So that's good. And usually after a while, the sensation kind of dissipates and calms down, so
Very
you can
much
relax.
so. Yes, I can say that also about my back when you do that, and that sort of thing. I'll let you take those out now.
Okay. So what we do here is, of course, we do the cotton ball, press down, and grab the needle, take it out.
And you know I don't even feel a thing.
You didn't. Good.
No, not a thing.
And now here we go, the sharps container. Here they go. And there we go again.
Now, do you pierce ears for people? If I wanted an earring.
Oh, that's a different license.
So
There's
you
don't
do that. Okay, so I'd have to go somewhere else if I wanted to wear earrings.
Actually, you know, jokes aside, yes, you would have to go somewhere else,
Right.
but people who have their ears pierced have to realize that there are a lot of acupuncture points on the ears, all over the earlobe, and while you think it's a, you know, it's a little legend that there are some points there that regulate your eyesight and your toothache, it's completely true. There are complete areas on the earlobes that regulate those functions.
Even a toothache?
Yes.
Acupuncture
analgesia is very, very commonly used in dental offices. I encourage everybody. It's very, very effective.
I didn't realize that.
Now there is a big area.
Yeah, there's a big area that I hadn't even thought of. But I just do know that it does help my back. And it's been
I'm very happy to hear
right,
that.
yes. So, and now I'm all set.
Yes. The ear looks fine.
Right.
You had a little treatment.
Right.
No, the needles don't leave any marks, obviously. And
so one would not know that I've been to the acupuncturist when you put needles in my ears.
No, not unless I leave the magnets there or something like that, as we discussed before.
Now, you also do massage therapy, and also, what are the cups? You on occasion have put cups on my back and move them around, and which has been awful helpful.
Great question. Massage therapy. Now I have to make it clear. I'm not a massage therapist primarily. We have another massage therapist in the office that specifically just does massage therapy. But Chinese medical massage is definitely part of my training, and I use it where appropriate for, you know, to relieve pain, especially in orthopedic patients. For children, I sometimes do full body massage,
Right.
pediatric massage, and I don't use the needles so much if they're needle shy. With the cupping, however, cupping is another form of Chinese medical therapy. It involves a glass jar with the help of which we create a suction over the areas where there's pain. So the back and the hamstrings are perfect examples of that. You know, the shoulders,
Right.
the trapezius muscle are primary candidates for that in a lot of patients because we all tend to have a lot of tension in those areas. It is a heat therapy, so we do create the suction with the help of some fire, traditionally. Now the patients can get the cups where they just pump, like it's
Okay.
a blood pressure cuff.
Okay.
But that heat element, I believe, is very important. There is a way to do deep tissue massage. The sensation is that of a deep tissue massage, as you know. And the way to create it is to do what we call a sliding cup, which is to put the Chinese medical lotion with some medical herbs that would create an analgesic effect, and slide the cups over that, up and down the back. And the
So
sensation...
that's what you're doing when you put the cups on my back and you're moving them around. You have
Right.
put a lotion on beforehand.
Correct. Otherwise, it would pull the skin. So those would be stationary cups. If you don't put the lotion on, you just leave the cups in place.
Okay.
And we've seen on a lot of people, even in magazines and so forth, that some of the very famous people had the cupping massage done or the cupping therapy done.
Right.
It sometimes leaves some marks, you know, if they had a lot of muscle spasm and so forth. Usually goes away within a couple days. With the sliding cup, I barely ever have anybody have rings on their backs and so forth because it just, you know, circulates the blood. The effect is nice and relaxing. It's just like you got a deep tissue massage.
Now, the last time I was in, you gave me some pills to take, which were very, very small, and I have to take 8 of them 3 times a day.
Correct.
Right.
So that brings us to another big part of Chinese medicine, which is Chinese herbal medicine.
Right.
You know, that is a separate area. It takes a lot of training. It's what we have in the office a lot of the time just to dispense to the patients is the classical formulas from very reputable companies. All the ingredients are tested. You know, a lot of the ingredients nowadays are organic and so forth. You know, there's a lot of concern about the safety of herbs. By and large, they're very, very safe. For pediatric patients, the formulas, the doses are reduced, the concentrations are reduced. We always take into consideration what other medications you may be taking, if there are any other concerns.
Right.
What you're taking is a classical formula for back pain.
I see.
So the ingredients there essentially promote circulation, relieve the pain, and also work in a Chinese energetic way on the energetic systems that are responsible in Chinese medicine for keeping your back healthy.
Okay. So that what I'm really doing is I'm helping myself to help myself.
Exactly, exactly. So when I see that the patient has gone through a couple treatments and we have good results, I usually suggest that to enhance the effect of the treatment, we take some herbal formula with
Right.
it. It's usually, you know, I always supervise the herbal formula. I would never let you go out there and say, you know, oh, take it whenever.
Right.
I'll always check with you, even if you don't come in for acupuncture so often anymore because you're in the maintenance stage and you come in as needed or once a month just to, you know, have a treatment for your general health.
Right.
I will always check with you how you're doing with your formula.
Thank you for a most interesting and informative session. And I close with this thought. I'd like to encourage you, because I'm not a shill for her and for the acupuncturists, that if you are in pain, it does work. I don't know how, I must confess, but I was hesitant. I was reticent. I wouldn't go. And now I'm glad that I've gone. And just hopefully this program will encourage you to seek help. Help from someone who knows what they're doing.